Hey everyone, in this today lecture we are going to discuss related to the exam preparation for the Medical Surgical Nursing 2 of second year GNM nursing students. So in the second year GNM we are having the Medical Surgical Nursing 1 and Medical Surgical Nursing 2. So the related to the exam preparation of the Medical Surgical Nursing we have done in my last lecture, the Medical Surgical exam preparation for the Medical Surgical Nursing 1. So in the today's lecture we are going to discuss related to the Medical Surgical Nursing 2 syllabus. So in this Medical Surgical Nursing 2 we are having 11 units. So in that 11 units we are having the first unit oncology. The word oncology only is going to tell about the study related to the cancer. So in the cancer or in this unit we are going to be study how the cancer is going to be affecting and how the stages it is going to be developing and what is the classifications of the cancer, and we are going to study in detail related to the individual organ cancer and all. Including that one, at the last we are going to study what are the treatment modalities for the cancer. So in our body we are having the major organ system like the oral will be there, the cardiac will be there, the lungs will be there, the GI system will be there, the endocrine system will be there. So the every organ we are having. So related to that organ, the cancerous we are going to be studying, including the major important the treatment modalities. The different treatment modalities we are having like chemotherapy, radiation therapy, surgical therapy, brachytherapy, the bone marrow transplantation therapy and the hormonal therapy. So in the every individual treatment we are having the different the treatment modalities or the management we are going to having. So in the chemotherapy the management will be done with by using the drugs and all. In the radiation therapy we are going to have the management by using the radiation like UV radiation, ultraviolet radiations we are having. So that one we are having. And in the surgical, so if suppose we are treated first with the chemotherapy, if it was not cure then we will go for the surgical. So in the surgical we are going to be removing the complete part or we are going to be removing the partial part of that organ. So it is will be related to the surgical. So apart from this one, if like the particular the specific cancers like the blood cancer will be there, like the leukemias, for them we will go for the bone marrow transplantation therapy where we are going to complete the exchanging of the bone marrow center. And apart from this one, so some of the cancer which will be related to the endocrine system, like it will be the any tumors of the pituitary will be there, the tumors of the thyroid will be there, there we are going to be done with the hormonal therapy. So and this is a very one of the important topic. So here we can expect the short essays, long essays and the meaning of that the particular word, the true or false, the everything we can going to be expect from this one. And this is the one of the again very important topic for the MSN-2, that is Medical Surgical Nursing 2. So this is about the oncology, right? Then next we will move on to the second unit, the management of the disorders with the breast. So the breast cancer is a very important topic in this unit. So the breast cancer will be occurred by various reasons, but when we are going to have the some diagnosis like mammography we are having for this one, which is by using the radiation. And apart from that one, so we are having the very important one of the diagnostic, that is breast self examination. So in short form we are going to call it as a BSE. So this is the not only used for JNM people, this will be going to ask for the even BSc students also. It's a very important topic in the BSc, that is breast self examination. The every reproductive age group females, okay, especially the reproductive age group females after their menstruation, if it was been on the day of 7, if it was been on the day of 7, for the next month after their next menstruation also on the same day they need to have the breast self examination. The diagnostic criteria for the breast cancer will be the mammography is one of the important topic, and the next will be the breast self examination. So that has need to be done by the every reproductive females after their menstruation, after the last day of the menstruation to that 7th day. So if in this month after the last day of the menstruation, or the 7th day if they are going, the next month after the last day of the menstruation also, the same day only they need to have the breast self examination. So that is a very important topic we are going to be see here. So after that, the next will be the management. So in the management, especially here, we are going to look over for the hormonals. So hormonal management we are going to try, the chemotherapy we are going to do. If it was not cured by these, then we will go for the mastectomy. So that is removal of the breast. So after that one, so we are having the some of the forced mastectomy exercise. So again, that is also again important question for the examination. So overall, the disorders will be related to the management of the disorder with the breast. So there especially we are going to see the breast cancer and all. So this is a very high list we can expect for the long essays and all. So this is about the second unit. So we move on to the third unit. So in the third unit, it will be the disorders of the integumentary system. So as we all know, the integumentary system is nothing but the skin. So whatever the disorders going to be affecting for the skin, the another one we call it as the integumentary system. So mainly the disorders whichever going to be affecting for the skin will be the bacterial infection, fungal infection we are going to be see. So here we are going to see like the some scabies and all we are going to see. So the Canadas we are going to see, the pimples we are going to see, the acne we are going to see. So like that some of the disorder we are going to see with the integumentary system. And for that one we are having the medical management like the antibacterial therapy we are going to having, the antiviral we are having, especially in the integumentary system. Apart from using the medicines, we are going to using the some of the creams and some of the soaps we are going to be using for the management of the skin disorder. So as it is a small unit, here we can expect the some of the fill in the blanks we can expect, and the true or false we can expect, and the short essays. So here the long essays will be might be not came, but the short essays will be come under this unit. So this is about the third unit where the disorders we are going to with the skin. Then the next will be the ophthalmic. So you know the ophthalmic is nothing but the eye. So here in this unit, the whatever the disorders is going to affecting for the eye, either it will be a degenerative condition will be there, either it will be an infective condition will be there, either it will be related to the old age condition. So in this one we are having the main important infective condition like the keratitis, conjunctivitis, the blepharitis. So which will be the blepharitis is nothing but, as you all know, this is the infection of the eyelid. The keratitis, you know, it is the infection of the cornea. The conjunctivitis, which will be the infection of the conjunctiva. So these are the like the some of the infective conditions we are having. But apart from this one, we are having the some of the degenerative condition like the cataract. So which is the high list or the hit list question for the examination. So we are going to see here the types of the cataract we are going to see. Then the management, especially the management, the surgical management. If you want to tell the exact word, means the surgical management of the cataract we are going to see. The apart from that one, we are having the one of the again condition called as a glaucoma. So where we are going to be, if we did not treat glaucoma, it will be definitely cause into the blindness and all. So that one is a very important. And apart from that one, the another one condition which will be related to the retina, that is retinal detachment. So in the ophthalmic condition, for every part of the eye, it will be a like cornea, the keratitis will be there. It will be for conjunctiva, it will be a conjunctivitis will be there. For the lens, the cataract will be there, including cataract, the glaucoma will be there. And for the inner retina, the retinal detachment is there. So the part of the eye is having the one high list question. So here we can expect the long essay question and the short essay question from the eye, and it is again one of the very important topic we are going to be having for the medical surgical nursing 2. Apart from these disease condition, we are having the two content like the eye banking and the eye donation. So that is also very important topic, and we are going to see for the National Eye Blindness Control Program and all. So these two topics also important, so better see for that one also. So this is about the fourth unit, ophthalmic nursing, or the disorder which will be related to the ophthalmia. The next topic will be the unit number 5, which is the ENT. So ENT is nothing but ear, nose and the throat. So in this only one unit we are going to be study related to the all disease condition which will be related to the ear. So in the ear especially we are going to have the disease condition like otitis media and the labyrinthitis, and apart from this one the tympanic membrane perforation. So these three are the very important topics we need to be studying in the ear. So in the nose also we are having the some of the upper respiratory tract infection, but that one you have already studied in the respiratory system, although once you are going to do the review there. So apart from that one, here we are going to be see related to the nasal obstruction and all, and related to the deviated nasal septum. So these are the two conditions we are going to see in the upper respiratory tract. And apart from this one, so we are having the throat. So in the throat region especially we are going to see about the laryngitis. So where is the part of the sound production. If there is any something is going to be affecting for the larynx, either it will be a paralysis will be there, either it will be obstruction will be there, either it will be infective condition will be there, it is going to affecting for the individual voice and all. So in the total overall ENT topic you are mainly going to be highlighting for the otitis media, labyrinthitis and the tympanic membrane perforation, deviated nasal septum and the laryngitis. So including these all we need to see about the care of the tracheostomy patient. Okay, the care of the tracheostomy which will come under the throat region. So in this question we can expect the short essays, the fill in the blanks and the meaning of the following, like the one of the word we are having in this unit is like a quinsy. The quinsy is nothing but the peritonsillar abscess. So like that they are going to ask for the meaning of that word and all. So this is about the fifth unit. So next we will move on to the next unit, the very important unit. So high lit and the high rated unit, so that will be a cardiovascular system including the hematological. So in the togetherly we can call it as a circulatory, so which is going to be circulate overall our body. So in the cardiovascular system we are going to be study whatever the diseases that are going to be affecting for the heart. So in the hematological we are going to be study related to the whatever the problems related to the RBCs, WBC, platelets. So that one we are going to be study. So in the cardiac system if you are getting the any question and all, so better to write one heart diagram and the mention the parts, then you are going to be start explaining the disease condition. So if it is like the myocardial infarction will be there, if it was like the some of the valvular disorders will be there, so some of the septal disorders will be there, so some of the infective disorder like the endocarditis, myocarditis, so that whatever it will be there, so better use one heart diagram and mention the parts and start with the doing the explanation. So there we can expect the high lit question has the angina, the myocardial infarction, cardiac failure or the congestive cardiac failure as the CCF. So that one we need to be see with the cardiac. So with the cardiac we are having the blood vessels. So in the blood vessels we can study, or we need to be more point out on the atherosclerosis and the aneurysm. So these two will be the very important for the vascular. Then the next will be the hematological. So in the hematological disorder we are going to have the disorder related to the RBC. So if there is any decrease in the RBC count, if it was increased in the RBC count, the both is going to be cause the diseases. Like if it was a decreases, that is going to cause the anemia. If it was going to increases, it is going to cause the polycythemia. The same we are going to be see in the WBCs and in the platelets. So in the WBC, if the WBC are going to be increases, then the individual will be a risk for the infection and all. And in the platelets, if there is a decrease in the platelet, the condition we are going to see is the thrombocytopenia. So where it will be leads into the bleeding disorders and all. So in this unit we need to highly focuses on the anemia and the thrombocytopenia. So which may ask for the long essay, the short essay, and here you need to know about the normal values. So already you know about that in the first year, although you need to know about the normal values of the RBCs, WBCs and the platelets and all. So this is the whole about the unit number 5, that is cardiovascular system. From this unit we can expect the long essay, the short essays, the meaning of the following, true or false, though like this we can expect from this unit. So next we will move on to the next unit, so that is communicable diseases. So as you already know the meaning of the communicable diseases, so the diseases which will be transferred from one individual to the another individual, so that one only we call it as a communicable. So here we are having the some of the important diseases like the hepatitis will be there, the tuberculosis will be there, the common cold will be there. So like that the some of the communicable diseases we are going to having, and from this unit we can expect the short essays and the fill in the blanks we can expect. So as it is one of the communicable disease, so we are having actually the broad classifications in the communicable diseases. Okay, so although we are having the some expectation of the short essays we can expect from this unit. So you need to be study the highlight of the like the pulmonary tuberculosis is a highlight, the hepatitis will be the highlight, the tetanus, measles, mumps. Okay, so like that if you are go that it will be a lengthy is there. So you just know about the particular the diseases, the cause, the signs and the symptom and the mode of the transmission. Why? Because this unit is going to be mainly the we can expect in the fill in the blanks and the true or the false. So this is about the communicable disease. The next unit if you want to move, so next will be the nursing management of the patient with the sexually transmitted diseases. So the sexually transmitted diseases, we know the one of the most and the very popular diseases what we are going to call as the HIV or the AIDS. Okay, so HIV is nothing but human immunovirus, so that is going to cause the diseases. So that will be the AIDS, that is acquired immunodeficiency syndrome. So due to entry of this HIV virus our immune system is going to be decreases. So due to decrease in our immune system we are going to have the some syndromes in so that will be HIV and the AIDS. So this is a very important sexually transmitted diseases. Apart from this one we are having the gonorrhea, the syphilis, like this of the some of the sexually transmitted diseases we are going to have, and from this unit we can expect for the short essays, for the fill in the blanks and the meaning of the following we can expect from this unit. So this is about the total or the important topics related to the sexually transmitted disease. Don't forget to learn about or study about the HIV and the AIDS, including the National AIDS Control Program. So it will be the helpful for you to score in the high in the marks. The next unit will be the management of the disorders with the musculoskeletal system. So in this one we are going to be see the disorder which are they going to affecting for the muscles and the bones. Okay, so here we are having the mainly disorder like arthritis, osteoporosis, the rickets. So like this the disorders we are going to having in this unit, and these are the very important. So in this one the arthritis is a very important, and the osteoporosis. So including this one will be there, that is rheumatoid arthritis, which is an autoimmune diseases we are going to see in this unit. So here we can expect the short essays from this unit, and we can expect the meaning for this, the words we can expect, and the true or the false we can expect from this one. So apart from this one in this unit we are having the some of the congenital disorders. So that congenital disorder maximally they will be asked in the pediatric. So here although you need to just know the meaning like the kyphosis, lordosis and the sclerosis. So like that the some of the congenital disorders which will be related to the musculoskeletal system is there. So just have a one look, but the maximally that questions will be asked in the pediatric. So that is child health nursing, whichever you are having. So this is about the musculoskeletal system. So the next unit will be the emergency management. So the emergency management, here we are having the some of the emergency condition like the shock will be there, the poisoning will be there, the snake bite will be there, like that some of the emergency conditions we are having. At that time whatever the first aid management we are going to do, whatever the treatment we need to do, whatever the care we are going to given for the individuals. So regarding that one you are going to see in the this nursing management unit. So from this one we can expect the short essays and the meaning of the following. So the short essays like the shock may ask, and they may ask about the a person with the poisoning, what is the management or what is the first aid management we are going to be done for that individual. So like this, some of the emergency or the critical care or the critical situation, the disorders we are going to be learning in this unit. In the last unit but not the least, the emergency and the disaster nursing. So here we are going to see or we are going to be study if the any disaster happens. So what has the nurses, what is our role? So in this unit we are going to be learn related to the one disaster cycle will be there, and including that one, so we are having the triage system. So these two are the very important. So either they may ask for the any one phase of the disaster management cycle, or either they will be asked for the complete disaster management. Apart from that one, we are having the triage system. So you know about the triage system. The triage is nothing but depending upon the patient condition, we are going to dividing the patient into the three categories: the red, yellow and the green. If there will be a serious, the immediate treatment is required, we will take them as in the red zone or the red category. So if somewhat we are having the some of the minor treatment or the minor injuries will be there, that will come, we are going to take in the yellow zone or the yellow categories, and who require just first aid management and they will be sent for the home and all, that will come under the green. So this triage system is a very important, including that one the phases of the disaster management cycle. So here we can expect the role of the nurse in the preparatory phase, the role of the nurse in the recovery phase, the role of the nurse in the rehabilitative phase. So like that, the particularly the phase they are going to be asked. So here also we can expect the short essays, and apart from that one we can expect the meaning of the following. So such things we are going to be explaining, and the mainly the focus is on the disaster management cycle and the triage system, and with that one what are the small topic is there means you can cover that all things and all. So this is about the total syllabus which we are going to be having for the medical surgical nursing 2. So if you are going to have the complete the study related to this one, and easily we can track or we can tackle our annual examination. So this is all about the syllabus which we need to be prepared for the examination. So next we'll move on to the examination tips. So whatever the things, if the timetable announced, you will get the nervous, you will get the anxiety. So be cool for that one. If you are starting from the today, so the every exam will be the easy for you. Okay. So whenever you are going to be start for the preparing yourself, you need to have the first syllabus review already, whichever we have been seen, and the important topics for the examination we have seen. So first you need to look over for that one, and with that one the some of the minor elements, if it will be the one liners will be there or the diagrams will be there, whatever it will be there, you need to be prepared for that one. That will be help in your for the thing. So in that one exam tips, so when you are going to be entering in the examination hall, so we'll know the 75 marks theory examination will be there, with for that one 3-hour examination will be there. So for in that 3 hours, the whatever the things you need to do there, and you are not supposed to do there. So before going to take that one for examination hall, whenever you are going to examination hall, carry the black ballpoint pen with including the if it is a required, the necessary material like the scale will be there. If it was required, you can. And the one thing keep in mind, don't write with other pencil, with the pencil or the other ink pens. So you must and should use the black ballpoint pen, not to be gel pen. So ballpoint pen is the mandatory for to writing the examination, and make sure that whenever you are going to for the examination, you've been thoroughly prepared, and you are going to carry your hall tickets, your pens, and with the neat uniform and all. So there will be no any rules and regulation from the university, so to wear the uniform and all, it will be left out for your colleges. So how the college management is going to tell, you can wear according to that one, but you should you would need to have the pen and the hall ticket. It's a must and should. So after entering the examination hall, so you need to search your register number and sit freely without talking with the other people. So if you are going to talking with your friends and all, again it will be nervousness or it will be again anxious for you people. So until unless they are going to distribute for the booklets, so you need to be keep cool and the calm. So in this one particularly the booklets, we need to be enter our names and all, and we need to be mark for our register number and all. So this booklet has been given before 15 minutes for the actual session of the examination. So once they given the booklet, first you check all the pages will be correctly or they are not, or if it is any loose stitchings will be there, so that may be result in the outcome of the paper and all. So first you need to be look for the booklet, then next you start with the filling. So the name will be there, the subject will be there, the date will be there, including that one. So the like how we are going to filling the OMR sheet, the same way here we need to fill for our register number and all. So if you are having the anything confused, don't make the any mistake. For just you going to ask for the room invigilators will be there, you just take the help of the invigilator and fill up of that one. So after finishing the fill up in the booklets up to until given to the question paper, you just sit cool and the calm. So once the question paper has been given to you people, so initially don't rush or hurry to write the answers and all. So first 10 to 15 minutes you just go through the paper, you just analyze the paper, analyze the questions, whichever the question you are having the easy to answer earlier and which will be a tough, it we can be left for the secondary. So first you analyze and you make the some points in your mind, whatever the answer you can write for the particular question, then you start with the that question. So whichever will be tough for you, whichever the answers you might know or the mild you know, so you will be left for the later. So first whatever you know, first you are going to be attempting for that one. So this will be the some of the hints which you are going to be follow in the examination hall. So whatever you have been studied months together, weeks together, so the thing is going to you are going to represent in the answer booklet. So be thorough with the answer, and wherever it will be possible for the diagrams and all, so you just draw the diagrams with labelings and all. So that is the will help us to or help you to gain the extra marks and all. So this is about the some of the tips or the tricks which we are going to be utilize or which we need to be help us to gain the more marks in the examination. Thank you.